helping make your life easier. Moms Every Day.
Hey there, welcome to Moms Every Day. It's Hattie Cheek. We have Dr. David Denning with us today from Cabell Huntington Hospital. You know, we're almost to the end of Colorectal Cancer Awareness Month, which is March. So we kind of want to send everybody off with all the information that they need to know and that feeling that they should get to the doctor to get that colonoscopy if they haven't already and they're of age to do so. So first off, let's talk about what colorectal cancer is.
Colorectal cancer is a bad problem. It's the second leading cause of death from cancer in the United States and the third most commonly diagnosed cancer in the United States.
So it's up there. It's one of those things that I think a lot of doctors like yourself are probably very passionate about.
Oh, absolutely. It's something you can do something about if found early. That's why screening is so important.
So who gets colorectal cancer?
Anybody can get colorectal cancer, males and females, but it's a disease as you get older, with few exceptions.
So when you're of age 50, that's when we really have to start thinking about that. Why is it?
Well, at age 50 is when you start, the risk becomes higher. At age 50, we get reminders actually from the insurance company many times to have a colonoscopy performed. We get insurance companies tell us to go get physicals, and during the physical examination you should be evaluated for colorectal cancer.
But there are also other risk factors other than just age. So what are those?
Oh, if you have inflammatory bowel disease such as ulcerative colitis or Crohn's disease, if you've had polyps removed before, or your family and relatives have had polyps removed before, or if your family's had colon cancer, puts you at much higher risk. And there's also some peculiar inherited diseases that make you significantly higher risk, such as multiple polyps in the colon and that sort of disease.
So in those cases, what should people be doing at that point? Because the protocol is a little different than if you don't have those risk factors.
Oh, absolutely. If you have a family member that's a close relative of colorectal cancer, you should become screened earlier age than 50. Normally it's 5 years after the age when they develop colon cancer, such as your mother or your father. And if you have several relatives in your family, the same thing holds true for that. Also, if you have ulcerative colitis, which is inflammatory bowel disease, you need regular evaluation because it's known up front you're a higher risk to get colorectal cancer.
So it's really important to know your family history. I think a lot of people out there, they don't discuss everything that's happened. I wouldn't know if my parents had a polyp removed if it didn't prove to be anything in the end. So if that is the case, should you really be talking to your kids and talking to, you know, at least your blood-related relatives about this kind of thing?
Yes, you probably should, and I think times nowadays are different than when we were younger. I being much older than you, but that was stuff we never talked about when we grew up. Now we talk about everything. So
especially on Facebook, right?
Exactly right.
So chances are your loved one may have posted a status after their colonoscopy to let you know.
Or seeing it themselves.
Yeah. Oh gosh, I hope not. The day that happens, that's going to be a totally different story, I'm sure. Now when it comes to the symptoms, at least, you know, some people, they just wait for the symptoms every time before they go to a doctor. In this case, it's scary because sometimes there aren't any.
Well, that's right, but certainly if you have symptoms such as bleeding, cramps, diarrhea, constipation, those things that you didn't have before, those are warning signs to go see a physician. What we're interested in is somebody who doesn't have any problems, that the problem of colon cancer is found very, very early and you can be cured from it.
So those are the people who just have to go in for that regular colonoscopy. So what types of screening tests are there? Because I mean, everyone always throws around the word colonoscopy, but there are a few different options.
Yeah, the easiest thing to do is a fecal occult blood test. You can get the hemoccult card from your physician, take it home, and check your stool for blood with it. There's some elaborate blood tests and stool tests that can possibly be done as well. And you can get something less than a colonoscopy done. It's called flexible sigmoidoscopy. It only looks like 3 feet in the intestine, and the majority of colorectal cancers are in the lower colon, so they can be found if you're totally worried about a colonoscopy.
But still, if they end up finding something questionable, don't they just have to do a colonoscopy after that anyway?
You're exactly right.
Yeah.
Sometimes it's best to bite the bullet and get the long test done.
Right. So I'm guessing that's what you tell your patients when you discuss, when they're a little afraid of something.
Well, as a physician, you try to console the patient and make it so they're acceptable of the examination. That's right.
All right, Dr. Denning, thank you so much for stopping by. If you need any more information, need to learn more about colorectal cancer and the risk factors, just head to our website. It's WSAZ.com. You can click on the Moms Every Day tab and rewatch this interview. Thanks for joining us. Have a great day.